Depression is rife in South African workplaces, but many people are scared to tell their employers. 24% of respondents to a survey by health economics company Hexor said they had been diagnosed with depression over the past 12 months. A third of those who said that they had not disclosed their condition to their employer because they thought it would put their job at risk. Now, depression was reported across the spectrum, from domestic workers to CEOs. To discuss, we're joined by Hexor researcher Tienie Stander. Thank you for joining us.
Hi, thank you.
So is this statistically valid? Because then it's incredible, 24%. So that means 1 in 4 people in the workplace in South Africa has clinical depression. Is that correct?
Yes, that's actually correct. And it is statistically significant because the sample size was designed to be statistically significant for our study.
And you looked across industries, across workplaces,
yes.
Things like that across
yes.
the country?
Yeah, so we looked across the country. We tried to mimic the workforce in the country in different industries, every province, gender, age group, different bands of work, income level, educational level. So it's stratified as to mimic as much of our workforce.
And this is people who've been diagnosed, is that correct? So
correct,
there could
by
be
a
many
healthcare
more,
professional.
Okay, so there could be many more undiagnosed.
Yes, yes. These are people who self-reported that I was diagnosed by a doctor having depression.
Okay, this is incredible. 1 in 4. Why isn't there a bigger fuss? Because this is a scourge.
Well, I think that's part of what one would like to create with research like this, is knowledge, and that through that knowledge you can react. If you look globally, the problem is actually bigger. It's more than 24% in Europe. And if you look at the economic burden associated with that, 90 billion euros per annum spent on depression. But the scarier part is that of that 90 billion, 62% will be borne by the employer. It's not the medical cost, the doctor and the pills. It's productivity loss, 62%. So we need to be ready for that in South Africa.
What is the cost here in terms of days lost productivity?
So the days lost on average, people with depression have 18 days sick leave per annum, 18. And that is only absenteeism. What we also see in our research is that people tell us they're present at work but not functional. So this is a term we call presenteeism, being present at work but not functional, not effective. And we haven't quantified that in monetary terms. And that's going to be a significant part of the loss of productivity. Being at work but making mistakes, indecision, not being able to make decisions, not being able to lead your teams, not being motivated, those kind of issues.
So is there an opportunity here for the workplace to get involved, like you say, in the education, to help people to go and get the help that they need?
Yeah. I think there's 2 parts to the help. If I have depression, I need to take responsibility personally. But I do think that in business there's a responsibility as well to create an environment that's conducive for performance, to support people with depression, early detection, have helplines or whatever the case might be. By 2030, this is going to be the disease that causes the most disability in the world.
Sure.
More than HIV, TB, car accidents, it's going to be the highest. So we need to do something about it.
This isn't new. So why haven't we evolved to a point where people can go and tell their managers? It sounds like employees are fearful. Managers themselves don't know what to do as well.
Yeah, I think in both those cases you're right. Stigma, discrimination, big issue. We found in our research that more than a third of people said that I will not disclose if I was diagnosed by depression, and 37% of them said the reason being that I will be discriminated against. It will affect my job. So that's
that
profound.
Sounds like managers need training.
Managers need training. They need training to understand the disease, to recognize it, but also to be empowered and supported, for instance, by HR. 50% of managers said, we have no support from HR. So we're not geared for that. I think one must compare this to HIV 20 years ago in South Africa. We were not geared for that epidemic. Today we're geared for that. But there were no policies in place because we did just not understand the burden of this illness. Now depression, we know it's coming and we can prepare for that.
What is your advice to somebody who is clinically depressed and wants to approach their employer?
Well, very difficult. I would say firstly approach your doctor and get treatment. If it still impacts on your work, on your productivity, then I suggest you do go to your line manager and say, listen, I'm under treatment, I'm taking responsibility for this, I might not being able to make decisions as far as these, but I'm on treatment and I should be better. Because the prognosis is actually very well. People who are treated well respond well in a majority of cases.
Finally, where do you go from here? Are you going to continue these surveys? It seems like this is something we have to focus on and watch in the workplace. And is this just modern life, Tienie, or is this also the workplace making people sick? I remember years ago complaints about open plan offices, but that's the way we're going. Everybody now seems to be open plan, despite that lack of privacy, things like that.
You know, in terms of the first part of the question, the next steps would be we want to publish this, obviously, in a peer-reviewed magazine to make it, put it in the public domain so many people can see this and respond to it. In terms of the why this disease, I'm not sure. I know there are many triggers. There are many triggers like stress, work environment, family stress. Most likely those things are the triggers that's causing depression to become more prevalent.
All right, thank you for your time this afternoon. Something that we have to address, depression in the workplace is rife. That was Tienie Stander from Hexor.